Good morning, everyone. I now call to order the regular meeting of the Irvine Advisory Commission for Older Adults. The time is 10 a.m.
Nope,
9 a.m. Recording Secretary, please call the roll.
Commissioner Chen, Commissioner Jacobs, Commissioner Sadi, Commissioner Sandlin,
Present.
Commissioner Singh,
Yes.
Commissioner Wong, Vice Chair Owens,
Present.
Chair Jacknick.
Here.
The quorum is present.
Please rise if you're able and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, with liberty and justice for all. Recording Secretary, please read instructions on how to participate in the meeting via Zoom.
Thank you, Chair. To participate in today's meeting, members of the audience who wish to speak, please enter your name in the speaker kiosk and indicate what item you are speaking to. For those who wish to participate virtually, visit zoom.us using any web browser or the Zoom app on smartphones or tablets and entering meeting ID 160-418-2008. The passcode is 100495. You may also participate in the meeting by calling 669-254-5252 and entering the same meeting ID and passcode. The meeting ID and passcode are available on our webpage at cityofirvine.org/older-adult-services/Irvine-advisory-commission-older-adults and selecting agendas under the Minutes and Agenda section. Those who wish to provide comments via Zoom are asked to enter the speaker queue by raising their hand electronically. The recording secretary will call your name and ask you to unmute your microphone at the appropriate time. Those dialing in by telephone will be identified by the last 3 digits of their telephone number. We ask that you please state your name for the record. The time limit per speaker for agendized and non-agendized items are noted in the posted agenda and shall be established based on the number of requests to speak submitted before the first speaker is called. Requests to speak submitted after the first speaker is called shall receive 90 seconds. The City of Irvine also continues to offer the e-comment feature for all agenda items. Those who wish to comment on matters before the Older Adults Commission may submit written comments by clicking e-comment on the Commissioner's agenda webpage. All comments will be provided to the Commission as part of the meeting record and will be uploaded to the City's website. Any e-comments received before, during, or after discussion of these items will still be included as part of the official record. For technical assistance with Zoom, please call 949-724-6078. For any other questions or assistance, please contact Commission Liaison Ryan McGraw at 949-724-6732 or via email at rmcgraw@cityofirvine.org. Thank you.
Thank you. Are there any introductions?
No introductions this morning, Chair.
Thank you. We have 3 presentations this morning. We will begin with our Distinguished Service Award to 2 individuals. Will Patty Sosi please step to the podium? This award is bestowed with sincere appreciation to Patricia Sosi, is that correct? Susi, I'm sorry.
Oh, that's okay.
For her dedicated service and unfailing commitment to the Irvine community. Since January 2023, Patricia has devoted over 505 hours to volunteering with Friends of Outreach and the Meals on Wheels volunteer driver program. Patricia's dedicated services made a significant difference in the lives of Irvine's older adults. Therefore, the Irvine Advisory Commission for Older Adults hereby recognizes Patricia Soucy. Excuse me. Would you like to say something, Patricia?
It's an honor to get this award. I was shocked when I got notified. And I just want to say I do this in honor of my parents that were very involved in their senior center in Costa Mesa. And I just love all the seniors in Irvine, and I love the people that I work with and all the employees at Lakeview. They're the best. So I just want to say I really appreciate this. Thank you.
We thank you. If you'll step forward, we'll come to present the certificate to you.
You're going to get up and down a couple of times.
If there are any friends or family members of Ms. Soucy that would like to join in for the photo, you may do so at this time.
Next, will Nava Prakash please step to the podium?
Can I see that after you're done so I can write down the names? I don't know how to spell them.
Okay. This award is bestowed with sincere appreciation to Nava Prakash, is that correct? For her dedicated service and unfailing commitment to the Irvine community. Since January 2024, Nava has devoted over 284 hours to volunteering with the Fitness Center Recreation Program. Nava's dedicated service has made a significant difference in the lives of Irvine's older adults. Therefore, the Irvine Advisory Commission for Older Adults hereby recognizes Nava Prakash. Nava, would you like to say something?
Sure. I'm truly honored and humbled to receive this award today. And I'd like to thank everyone who has given me this opportunity, and very happy to receive this award. Appreciated. And volunteering, for me, volunteering is about giving back, helping others, connecting with others, and helping the older adults to receive their goals, to achieve their goals. And I also like to thank Oma, our fitness coach, for giving me the opportunities to help others. And I also like to thank the Travel Coast staff, who are very friendly and very helpful. I like to thank my family, my friends who are here today to support me. And I like to put a smile on somebody's face. That makes me very happy. And I will try my best to continue to help others in whichever way I can. And thank you for this opportunity. And thank you for recognizing me.
Beautifully said. Please step forward.
Hold on, Amber's going to go ahead and take one for staff, and then we'll have the family come down. Any friends and family that would like to join in the photo, please do so at this time.
Yeah, see, I write notes, and I have no way of spelling any of these names. So, yeah, when you get done, maybe I can write it down.
Yeah, Patricia says.
Did we have another one?
No. Our next presentation will be from the county staff on the Caregiver Resource Center. Will the presenter please step to the podium and introduce themselves?
Good morning, everyone. My name is Gabby Vendries, and I work with the Caregiver Resource Center of Orange County. Yes, 1 second.
While my colleague is getting that ready, my name is Evelyn Barajas, and I also work with the Caregiver Resource Center of Orange County. Thank you for having us today.
That's not working. Oh, there we go. Oh, there you go. Oh, you're good. Yes, so again, thank you so much for having us today. Today we'll be presenting on long-term care options. But before we get into that, we wanted to give you all a brief overview of the services that we provide as the Caregiver Resource Center. Sorry. Some technical difficulties, sorry.
The arrow keys not working? No. There you go.
Is the center an actual physical place?
Yes,
And where is it located?
it is in Fullerton, right across the St. Jude Medical Center.
Would you repeat that? In Fullerton where?
Right across the St. Jude Medical Center.
Oh, St. Jude Medical Center. Thank you.
So as my colleague mentioned, we would like to present a little bit more about the Caregiver Resource Center of Orange County before we go into long-term care options. So as I briefly mentioned, we are located right across the St. Jude Medical Center in Fullerton. So we are a nonprofit program of St. Jude Medical Center. Our leadership comes from Providence. However, our funding comes from the state and federal government through the Federal Older Americans Act and Family Caregiver Support Program. So we've been serving Orange County since 1988, and we serve the entire county, even though we are located in North Orange County.
So who are we? We are a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. Our center's mission is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. Our goal is to make sure caregivers don't feel alone in their journey and have the proper support to care for themselves and their loved one.
So a little bit about the eligibility for our CRCOC clients. CRCOC, short for Caregiver Resource Center of Orange County. First and foremost, both the caregiver and the care recipient have to reside in Orange County. Does not matter what part of Orange County, as long as it's incorporated part of Orange County. And what classifies a caregiver to become one of our clients? The adult has to be caring for either a person under the age of 60 with adult onset cognitive impairment, such as traumatic brain injury or adult onset Alzheimer's or any form of dementia, a history of strokes, history of seizures, or a person caring for someone who is over the age of 60 with a chronic illness that needs significant help with their activities of daily living. So a minimum of 2 activities of daily living, whether they're partially dependent or fully dependent on assistance from the caregiver, such as walking, eating, transportation, bathing, all of those daily activities of living. Now to touch a little bit about the CRCOC services, we offer support groups, specialized information, education and training, such as legal workshops, counseling, caregiver assessment and care planning, respite assistance. So some of these services, I will break them down a little bit more. Some of these services are available to anybody in the community, whether they are a client of ours or are actively caregiving for someone. And those services are support groups, specialized information and referral, and any educational classes and events that we have in the community. All of these services are free, and for anybody who does decide and is eligible to register for our services, we also provide individual counseling, caregiver assessment, long-term care planning assistance, respite assistance, amongst other types of assistance with our government funding.
Excuse me. So our most popular service is our respite assistance. So once we get our caregivers that free time to themselves while their loved one is being cared for, they're not sure what to do with that time. So we like to pass out this handout with 50 ways to take a break. It gives them some ideas on how to spend that free time. They can pet a furry creature, create their own coffee break. There's climb a tree, but again, just safety first. So yeah, so these are just some ideas on how to spend some free time once they receive it. And this is our center's contact information. It has our address, our phone number, and our website. You can go on our website for any education and classes. We also have support groups, and any caregiving questions or needs, please don't hesitate to give us a call. Even if you're not sure if you meet our eligibility requirements, we're here to help. And now we'll get into our long-term care options part of the presentation. Usually this class is about 2 hours, but we condensed it into 15 minutes. So if you have any questions or need more clarification on anything, we'll be around after to answer any questions. Or you can call our center.
So we'll be beginning with in-home care options. Here's a brief overview of the in-home care options that are available to the community. We have in-home caregivers, home health, adult day programs, palliative and hospice care, and we'll be looking a little bit more in detail in the next slide. So in-home caregiver can be private or informal, informal method of providing care for a loved one. So this is based on non-medical care versus home health is medical care. So it'll entail what the individual needs in terms of a physical therapist, nurses, what they need to remain healthy at home and receive that medical assistance. Now for adult day programs, there are two types of adult day programs. There's the social models and the medical models. So that also is based on the ability and the capabilities of the participant. So they'll be having a thorough assessment to see what is best fit. Medical models tend to have a lot more medical staff where you have your social workers, your OTs and your PTs and your nurses there to assess and assist as needed during the time that they're there at the program, versus a social model tends to be a little bit more free and just based on social activities. And the last one is palliative and hospice care. They both focus on assisting somebody at home or in a hospital setting as well. Who have any type of serious chronic illness. The comparison is that hospice has a life expectancy of less than 6 months, but that's not to say that someone can go on hospice and be extended more than the 6 months, or go on hospice, be reverted back to palliative care because they're still doing very well. So these two are a little bit more flexible, but hospice care is a little bit more intensive because it has that life expectancy within those few months that the loved one might pass.
Now we'll talk about some out-of-home care options. There are 3 types: residential care facilities for the elderly, continuing care retirement communities, and skilled nursing facilities. So all of these are not covered by Medicare, and all of them except the retirement, the continuing care retirement communities, except the assisted living waiver, and we'll expand upon that more towards the end. So for residential care facilities for the elderly, these facilities provide a room and board, and there's 3 types. There's boarding care homes, which are small and usually located in residential homes. They usually have around 6 or 8 residents. There are assisted living facilities. They're a bit larger, and they have more activities and staff, but they do have a lower level of supervision. And then there's memory care facilities, which are larger, and they have specially trained staff who can treat memory impaired persons. So with continuing care retirement communities, also known as CCRCs, they are life plan communities. So with those, the resident can start out living independently, and then as their care needs change, they're moved from different areas on the campus. So they can go from independent to needing skilled nursing in the same community. And then with the skilled nursing facility, they offer transitional care in a medical facility, and they are typically referred to after a hospital stay. And usually Medicare covers up to 101 days. And it can be covered by Medi-Cal if there's prior authorization from your physician.
So as my colleagues started touching upon Medicare versus Medi-Cal, we'll go a little bit more in depth in that. So Medicare is age-based, largely 65 and older. However, if you are under the age of 65, you may qualify based on a disability, and that's a thorough assessment to see if you do qualify. Now for Medi-Cal, it's largely income-based. There is no age requirement, and there are limitations on assets to be able to qualify for Medi-Cal. A little bit more regarding Medicare. Again, we acknowledge that there is a lot of information to cover, and we're trying to give a brief overview. To simplify Medicare, there are 4 parts: the Part A, Part B, Part C, Part D. Part A is largely focused on hospital coverage, such as inpatient hospital, nursing facility stays, hospice, and some in-home health care, so a lot more intensive care, intensive medical care. Medicare Part B is focused more on medical coverage that in terms of doctor visits, medical supplies, and outpatient care. So it's what we usually use on a day-to-day basis when we go see the doctor. Now, Medicare Part C, it's Medicare Advantage. Usually Medicare Part C, we do see a lot of incentives because it's not based off the normal bundle of Medicare, and it's more on a focus on shopping for additional plans for Medicare. So there are times incentives for over-the-counter medical coverage as well as prescription drug coverage over the counter. Now, Medicare Part D is known as the prescription coverage part. So this is where when we have seniors who have Medicare Part A and Part B and they don't have Part D, they're still facing a cost because of those prescription drug costs. So that's also an additional add-on to the usual Medicare plan. And this just for the people who are a lot more visual like me, we added a graphic. So Part A, again, is hospital coverage, Part B, medical coverage, Part C, Medicare Advantage, and Part D, prescription coverage.
Yeah, so about Medicare versus Medi-Cal. Medi-Cal goes beyond Medicare's coverage in a few key areas. The most important is long-term health care services and support. So Medicare has a limited coverage for long-term care, with most benefits confined to skilled nursing facilities for short periods. And this kind of gives you like a visual on the differences of coverage between Medi-Cal and Medicare. Even if our clients feel that they won't qualify for Medi-Cal, we urge them to still apply because of all that is covered through their programs. And again, Medicare, it does partially cover skilled nursing and home health and hospice care, but you can see the difference with Medi-Cal. There's so much more support and services for caregivers and their loved ones. And then also, Medicare has special programs. They offer the spousal impoverishment protection laws, which is a special part of Medi-Cal that allows the well-off spouse to take care of their less well-off spouse without going through like all of their income. And it's designed to prevent the impoverishment of the well-off spouse. They have a program called Home and Community-Based Alternatives Waiver, and that allows Medi-Cal beneficiaries with high-level care needs to continue to live at home as opposed to in a facility. And then there's the Assisted Living Waiver, which is designed to assist Medi-Cal beneficiaries to remain in the community as well, as opposed to a healthcare facility.
Now, we also wanted to cover other special programs, both Medi-Cal and Medicare on special programs. So the first one, long-term care insurance, it is a private insurance. So it works like any other insurance, so the costs of policy vary on age, policy type, coverage selected, health conditions. But with long-term care insurance, you do have support in covering long-term care services such as in-home care, boarding care, skilled nursing facility. We also wanted to take note of Veterans Affairs. There are a lot of veterans in our community, so Veterans Affairs also provides some form of long-term care assistance with pensions, veteran-specific homes, adult day, health day programs. They also help provide coverage for those fees as well. We also took note of SCAN. SCAN is also an insurer, but we wanted to highlight their respite benefit. They have a respite benefit of up to 40 hours per year that anybody who has Medicare can also tap into that. We also noted the Caregiver Resource Center, as we briefly mentioned in the beginning. We're dedicated to Orange County, but we are part of a statewide Caregiver Resource Center system. So there are a total of 11 in each county, and California has their own pertaining Caregiver Resource Center. And so same thing applies in terms of eligibility, what they provide, educational classes, counseling, long-term care planning, respite assistance, and it just depends where the loved one and the caregiver reside to see which caregiver resource center can provide them that assistance. And these last three are more Medi-Cal based. So we have the Multi-Purpose Senior Services Program, which is also known as MSSP. So their goal is care management to help elderly adults remain at home. So they also tap into Medi-Cal resources and eligibility as well. So the loved one does have to have Medi-Cal, and they're able to provide respite assistance, transportation assistance, meal assistance, on top of other similar assistance that CalAIM also provides. So CalAIM is a transformative 5-year initiative redefining Medi-Cal to enhance members' health outcomes and quality of life. So their assistance is based on housing, medically tailored meals, personal care, and homemaker services, respite services, as well as multi-purpose senior services programs. So they kind of work hand in hand. It just depends on where your needs can be best met. And the last one we also wanted to cover, which is PACE, Program of All-Inclusive Care for the Elderly, and their goal is to help older adults remain independent at home through a long-term comprehensive healthcare program. So these are signified as adult day health programs, where they do have a full medical staff, where they have the doctor, the registered nurses, the certified nurse assistants, the social workers there, and they're able to create a better connection to your doctor at your medical office. So that way everything's intact and you get that additional support while you're at the adult day program. So it's a little bit more than a regular adult day health program, but it's exclusive to Medi-Cal recipients, and it encompasses a lot in terms of preventative and primary, acute, and long-term care. That was our presentation. We know it's a lot of information, and we were trying to make it as brief as possible. So we are here for any questions or concerns that can be voiced, as well as if you have any question or concern that comes up later in the future, you can always connect to our center. All of us take turns on the phone line, so we're all eager and ready to assist with any questions and concerns. But we'd like to, once again, thank you all for having us today.
Yes, thank you again for having us. We brought some of our materials, our class calendar, our support group calendar. We'll leave it at the entrance. And yeah, we hope, thank you again, and we hope you all have a beautiful, blessed day.
Thank you so much.
Don't go anywhere.
We want to wait for questions.
Of course.
So much. I have some questions. That was very helpful information. When you mentioned the respite care is the most popular, which I very understand, can you expand on that? How much time people get, how often they can go, and how they coordinate that?
Yeah. So again, we offer grants for respite care. The way it works is a caregiver would call and register as a client. So they do have to meet that eligibility requirements that Evelyn talked about. And then in about 5 to 6 business days, they're matched with their social worker or family consultants who work as like their point person for like all their services. And they will complete an assessment with the caregiver. And they'll use that information from the assessment to apply for the grant on the caregiver's behalf. And that process can take anywhere between 1 to 4 weeks. But once it's approved in like a lump sum, and that amount is not dependent on like their income or their insurance. It's all dependent on like the caregiver's stress and the situation. And the caregiver would work with the caregiving agency that they choose to use those funds until they're exhausted.
I do want to add that our respite grants, what we label as respite assistance, they're usually short-term and one-time only. But as Gabby mentioned, they're given in a lump sum. So we've seen people obtain about more than 100 hours. And so they have that family consultant to assist with setting up the caregiver, finding the caregiver agency. There are times where maybe the caregiver is not a best fit. So also the family consultant can also assist with finding another caregiver agency and another caregiver. But we do give priority to people who this is their first time getting the respite assistance, because we know the need is high, and also with our funds we try to give it out fairly as well.
Okay, thank you, very helpful. So it sounds like people can, once they get the hours, they can distribute based on their needs. Another question I had in mind, a situation I see very commonly is when an older adult may not be aware or acknowledge their limitations, whether that might be memory challenges, or getting older, forgetting to pay bills, getting lost, forgetting things in general. And then the family members are very spread thin, are unable to take care of family members. So I feel like that creates a very challenging situation. I feel like there's no answer to it, but it's very common. So I'm curious how you would address such situations to kind of help both the individuals get the support they need.
I will say we get this a lot, where we get those calls a lot, or even sometimes people come to our center. They're more than welcome to come to our center and talk to us directly. And usually we do take precaution to see what the situation is, how we can assist immediately. It is a little bit hard in terms of providing those grants, those assistance for respite, but we do acknowledge where at times we do have the loved one who is caring for the other loved one, the care recipient, and they acknowledge that it's time for them to wane off because they have other priorities or responsibilities, and it's just becoming overwhelming. What we do present to them is the possibility of enrolling with us as the current caregiver, having us work through that process that Gabby mentioned to get them that respite assistance, use that respite assistance to give them some relief from that stress and the feeling of overwhelmness. And while they're navigating that and starting to get some time for themselves, the family consultant will proactively work on trying to get a long-term caregiver to replace them, or at least wean off their hours so it's not their entire responsibility in the near future. And so that way they're still involved, but it's not their entire responsibility as well.
Yeah, thank you for sharing. It's hard when the affected older adult says, I don't need any help, I'm not going to go anywhere. So I feel like that makes it sticky. But it sounds like your experience with that situation, it could provide some guidance for the family. Good to hear. Thank you for sharing.
Definitely biggest thing is that guidance, right? And then we also want to meet where people are at. Sometimes they're not ready. Sometimes they can acknowledge, but don't find it appropriate in the time to take those next steps. Or at times we do have people who call and they'll mention, my loved one needs a caregiver. And as we're building rapport, we're understanding that they're the ones actively providing care for them. So it's assisting them where they're at. And sometimes it's still respecting if they sign up and they just don't want to be labeled as a caregiver. We respect that as well. We just respect what they feel, what's important to them, and where they'll be heading.
Thank you for your presentation. I do have a couple of questions. Your continuing care retirement communities, how many are located in Orange County? And which cities are they?
We do have a list of all the continuing care communities. Off the top of my head, I'm not sure, but we can provide that information like after this presentation. Like we can email it. Sorry.
And with regards of with translation services, do you have that too? Because now it's one thing just to translate, but to actually converse in the language that the recipient needs, it's important. I try to translate for my parents. I lose half of it in the translation. So you do provide those services?
Yes. So all the staff is either bilingual in English and Spanish, English and Vietnamese. And we do have a newer staff member who can also speak Farsi, but he's a little bit more hands-on because he has other responsibilities to fulfill, but he's still there for assistance. And that is what we're naturally able to speak. However, we do have a translation services that we can utilize. So we're also able to serve Korean and Chinese currently, and we're looking to expand further because we know there is a bigger population of Farsi per se, and there is need for more languages as well. So currently we use the county language threshold to provide those services. So it's either us speaking directly to them if we're bilingual, or we use the county's translation services to provide those services.
In your staffing, are there healthcare professionals on your staff, or is it primarily non-medical folks?
It's primarily non-medical folks. Most of them have their master's in social work or their licensed clinical social work degree.
We do have like a master's in public health, but largely just social workers, either they're licensed or not licensed or working towards their licensure. So largely non-medical.
Thank you.
Of course.
Yeah. I was really impressed with the presentation and everything you offer. And I was kind of curious if there's like a waiting list. I would think that there's a lot of people that are in need, especially in Orange County, and I would think that you almost have to turn some people away even though they're eligible.
So with our services, we have like a revolving door, so we have no wait list. We try to get our clients from the time they register to speak to their assigned social worker. It's usually between 5 to 7 business days. So we try to like make contact like within that time frame, and we don't turn any clients away due to like due to the demand. Yes.
I will say that most of our family consultants have more than 100 cases, so they're dealing with more than 100 caregivers simultaneously, but we do not turn anyone away. So we just keep adding on to the workload, and we utilize teamwork to be able to provide those services that are needed when they're needed. So that way we don't turn anyone away and we don't have anybody on an active wait list. So as we're getting those calls, we're actively working in and registering them and getting them situated with their family consultant within 5 to 7 business days.
Well, even with the VA or the veterans, you are working with the government too, as far as helping the vets that are in need of a home or the care that you serve or the care that you provide.
Yes, we've helped lots of veterans get connected to VA services. And like there are special programs that offer like respite and like care and things. So we do help with that process, and we try to like especially make sure that we're providing for our veterans.
Biggest thing is that if they are connected to the VA or are looking to get connected to the VA with assistance from us, that does not mean that they no longer qualify for our services. So we don't look at that in order to deem eligibility. And that also entails that we don't look at any type of insurance for eligibility criteria, and we don't look at income either. And what we showed on that slide is largely what we look at, what the care recipient needs, what the caregiver provides for the care recipient, and if they both live in Orange County.
Okay, thank you.
Okay, so, yeah, my mic's on, thank you. So I just want to be clear. The Caregiver Resource Center is focused on the caregiver who is already in place for a family. You don't have a big referral list of people who want to be caregivers. You are working directly with those who are already providing some kind of level of care in a home that qualifies for possible services for the caregiver, which absolutely is a necessity for keeping everybody mentally healthy and physically well. Having been in that position myself for about 4 months this year. As far as the respite grants go, what is the average amount of a grant and how many grants are issued in each year? And with the federal and the state funding and all the moving pieces, do we anticipate continuing funding, or does the St. Jude Foundation have enough to continue to provide that? That's a lot of different questions. I realize.
Do you want to go? Largely, we've been seeing, I know you mentioned funding, based on funding, because we don't only just provide respite, we also provide what we call grants and assistance for transportation services, supplemental devices, and supplies. So we try to spread as much as we can, and what we're seeing being utilized, and respite is always number one. So largely, it depends on the funding cycle, but we've remained pretty consistent. So we're looking at about like over 100 hours, roughly around like 110 hours given to each caregiver when they receive that respite assistance. And we try to give them a time frame for them to utilize those funds to provide the respite. But we are flexible, we are adaptable, so we understand things might come up, we need to extend, prolong, and so we try to do our best. I know you also mentioned the St. Jude Foundation. We do have funds in there. That's kind of our safety net. And sometimes one thing I think we didn't really touch on is that we focus on informal, unpaid caregivers. However, we don't turn around paid caregivers like IHSS caregivers who are caring for a loved one. We still help provide services. But because we are overlooked on the Office on Aging and we have government funding, we can't provide respite assistance for them. That's where Medi-Cal would kick in. However, we are able to provide other services services like case management, long-term care planning, and all that assistance as well. So when we do have that foundation money, there are instances where we understand where per se that IHSS caregiver has an emergency and needs respite. That's where we would try to utilize those emergency funds that we have with that foundation to help provide the respite assistance that they need. So we technically don't tend to touch those funds because we know it's last resort, and we utilize them as needed. And I know you mentioned also with the funding cuts from the government and everything going on, currently we are secure. We are in a 3-year cycle with our grants, so we're in the midst of it. So our funding is secured for a while, and we will see after that, unfortunately. But there are some caregiver resource centers who are nearing the end of their cycle, and they are facing some funding cuts, and it's largely based on what the county can also provide, what's going on, how our services being utilized. So everything is relatively under the microscope right now.
Questions? One question was about where you're getting your funding, but you kind of touched on that. Sounds like it's from the state and the County of Aging. Thank you for that. Another question was, I was advised the City of Irvine is working on having a PACE center in the city, and closer than I think the current nearest one is in Anaheim. Given their expertise in the area, I'm wondering if you're working with the city on facilitating that, or the connection is.
Not really.
That's good news to hear. I wasn't aware of that, but we do work with PACE closely with providing our services to like their clients. But yeah, we currently aren't. But if PACE were to reach out to us and need support, we're always willing and there to like jump in. So
I will say, because their system is unique and also tedious, so creating that bridge is something that we've been actively working on. And as of recent, we're looking to do educational classes, support groups at the PACE Center that Cal Optima has near Orange Garden Grove area. So that's their only PACE Center, but I do know there are other PACE Centers, and largely our Ultimate or another Medi-Cal provider. So we're also trying to create that bridge with those PACE Centers, because it's very essential, and a lot of them do have a caregiver at home that might need that extra assistance.
That's a great resource. Sharing an email address, or what's the best way of reaching you about this down the line if questions come up?
Definitely our phone number, which is 714-446-5030. We can also provide our emails if you'd like that as well.
Yeah, email's great.
Yeah, of course. So mine is Evelyn, EVELYN .Barajas, B as in boy, ARA, J as in John, AS, @providence.org. So I'm happy. We're two of the community liaisons for the Caregiver Resource Center OC, so we're really happy to be ready to provide those answers and those resources that are needed for the Irvine community.
Thank you so much. Appreciate it.
Okay. I have a question about the PACE program. Is it now available in Irvine? I know it wasn't available everywhere.
I believe, I know each functions a little bit differently. I believe Cal Optima has shared with us that their PACE program is open to most of Orange County, if I'm not mistaken, going all the way down to South Orange County. I'm not sure if that really entails Irvine. I was under the guise that it entailed Irvine. I understood it was more of like not San Clemente, like down all the way south. But because they only have one center, I understood that they were trying to be inclusive as much as possible for all of Orange County. Now for the ultimate PACE centers, I'm not too familiar on those, so I can't speak a lot on those. But I believe they're the ones that are a little bit more specific to the city and the nearby cities that they can service.
Yeah, and do people have to qualify for Medi-Cal in order to be in the PACE program?
Largely, yes. Yeah. Their main focus is Medi-Cal recipients.
Okay, thank you.
Of course. I know Gabby shared a little bit, but a lot of times we do have care recipients that only have Medicare, and so we're always there to provide legal assistance so that they can see a Medi-Cal specialist to see if they can also get Medi-Cal, because there are a lot of differences of what they cover and what you can receive.
I know the asset level for Medi-Cal has just been reinstated for January. What is that level of assets? Do you know?
don't know the exact number on that. I'm more familiar with the income level than the asset. With spouses, it's more than $4,000 a month. And for an individual, they added a little bit more. It used to be 1,732, and now I believe it's over 1,800. So I believe they added about $100 or more for individuals. But a lot of times, I know we covered it a little bit in our presentation, we're seeing a spouse caring for their spouse. And we don't want them to be impoverished. So a spousal impoverishment is where it would kick in, and that's where it starts waning off those assets. So that way they're not largely affected, and they do the absolute most they can so that they can receive Medi-Cal. And that's why we partner up with legal aid and also lawyers from the Elder Law and Disability Rights Center, so that way they can provide that extra assistance to make sure that they can qualify for Medi-Cal, and largely with no share of costs, because that's another big thing.
My turn. If you were to divide your clients between those that are on Medi-Cal and those that are not, what percentage do you think that would be?
I would say that largely, well, because our clients are the actual caregivers, or so are you deeming the care recipient or the actual caregiver?
Whatever, whichever.
So we focus more, so we are there to serve the caregiver, but we understand that their hands can be tied financially if the care recipient doesn't have both. So we do focus more on that aspect for the care recipient, but we can also assist the caregiver. So when we look at the care recipient, I would say a large majority of them only have Medicare. I would say probably around 60 to maybe 65% are only Medicare, and the other portion have Medi-Cal. I want to say part of it is because Medi-Cal has those CalAIM services where they can get respite through CalAIM. They can get IHSS can pay for the caregiver. They can get transportation services. Adult day health centers are covered through Medi-Cal. So sometimes they're not really aware of what else they can tap in with us as well. But largely, a lot of care recipients only have Medicare, or sometimes the caregiver is unaware if they have both or if they even qualify for both. So we do use, I want to say that the Medi-Cal Specialist Grant and Assistance is probably one of the top 3 that are utilized, where we do, when we're building that wrapper, when they call in for the first time, and we don't focus on insurance, right, because it's not based on eligibility, but we do ask, does your loved one have Medi-Cal? Do you have Medi-Cal? To see where we can pull away on that financial strain and see where we can provide more resources for them. So I want to say largely, yes, only Medicare for the most part. But we are starting to see more of an influx because we are county-based as well. So IHSS and Adult Protective Services and Social Security Administration are actively trying to provide our information when they see someone in need as well.
That's my next question. Where do you get most of your referrals from?
Well, we get direct written referrals from the Dale McIntosh Center. And then for word of mouth referrals, they come from everywhere. We have medical social workers in healthcare settings giving us a call. We, on behalf of the caregiver, or the caregiver will mention that they received information from them. Sometimes we see adult day health centers that provide that information for the caregiver. Other times senior centers, largely everywhere, and we're doing our best to be even more proactive in the community, because there are community centers, like family resource centers, that aren't aware of our services or aren't aware if they do have active caregivers that would be eligible for our services as well. Did you want to add more? Or?
No, yeah, we're trying to get the word out there. So we go to like a lot of like community events and like health fairs and resource fairs. Yeah, and unfortunately we hear a lot that like we're like the county's like best kept secret, but we're trying to get the word out there to make sure that all caregivers have access and knowledge to like what we provide.
I do have one last question. Now, after the person passes, the caregiver's still around, do you provide services or support for those folks?
Yes, so we do offer, we have a support group called Transitional Support Group, where caregivers who the loved one that they're caring for has passed and they need like support on like how to move on or just adapt to like this new like phase of life. So we offer that support group. We do offer our caregiver, we keep them on our caseload until like we feel like they're comfortable and like set and like a good state of mind, like after their loved one passes and they don't need any more resources or support. So we offer that support group, and we keep them on our caseload until they let us know that they're good to go. Yeah.
Thank you.
Okay, thank you very much. That was very informative.
Thank you for having us.
Thank you so much.
Our final presentation will be an older adult support services overview presented by staff.
I think this is our best kept secret.
Definitely.
Good morning, Chair Deknik and Vice Chair Owen, and the members of Irvine Advisory Commission for Older Adults. My name is Hee-Jin Lee. I'm a community service supervisor. Today, community service program specialist Amanda Rigali and I will providing overview of Irvine Older Adults support services as well as updates on recent changes within our section. Our service goal is to provide resources and information that supports independence, dignity, and quality of life for older adults. Our primary focus is serving Irvine residents who are older adults as well as their adult children.
As part of the strategic plan, our section underwent rebranding and a reorganization of its service structure. One key change I'd like to highlight is the update in terminology. Our goal is to improve public awareness and more clearly communicate the purpose of our programs. Senior Outreach Services is now known as Older Adult Support Services. The Keene Center for Senior Resources is now referred to as Resource Linkage at the Keene Center. As part of the strategic action item to expand current resource linkage services, this program will soon be available at other senior centers as resource linkage at Trabuco Center and resource linkage at Rancho Senior Center. What was previously known as case management has shifted its focus to short-term follow-ups and is now referred to as resource coordination. Additionally, care managers are now called resource navigators. With these changes, we hope the public will more easily recognize and understand the services we offer simply by hearing the updated service names. Our service focus is resource linkage. Trained staff provide personalized assessments to identify individual needs and connect participants with available resources, either in-house or through referrals. We take a customized approach, ensuring flexibility to meet the unique needs of each participant.
These flow charts outline the in-house resources offered through the resource linkage. We are establishing partnership with the community organizations to provide these services on site where older adults feel most comfortable and safe. Let me walk you through the details of each in-house resources. Please note that while the details may seem a lot, a quick phone call or visit the Keene Center will connect them with the right resources. One-on-one consultations are free with experienced advisors ready to answer questions and explore available options. Services are included Ask a Nurse, where the HOAC nurses are on site to provide consultations about health benefits and offer important health education. For legal concerns, we are proud to have volunteer attorneys who donate their time to offer elder law services, supporting our community with trusted advice. When it comes to the finances, the Community Action Partnership helps to empower older adults with the tools needed to better manage money. For those navigating Medicare, the HICAP provides completely unbiased guidance for anyone new to Medicare or thinking about changing their plan. This is especially valuable during the busy Medicare open enrollment season from October to December. Medication reviews are offered by professional pharmacists who take a close look at prescription and give helpful recommendations to ensure medications are working for you. And of course, one of the most popular services offered is tax preparation services provided by ARP. Each of these services are designed to keep older adults informed, confident, and empowered.
The Medical Equipment Loan Program allows Irvine residents of any age to borrow medical equipment for 30 days at no cost. Available items include wheelchairs, walkers, crutches, canes, and knee scooters. The Volunteer Driver Program offers a volunteer-based transportation service for participants needing to get to non-emergency medical appointments. To qualify, participants must be Irvine residents age 50 and older and must be able to get in and out of a vehicle with minimal assistance. This service is available for up to 2 appointments per month. Support groups are designed to help individuals cope with physical, emotional, and caregiving challenges by providing tools and emotional support to navigate life's difficulties. We currently offer support groups for Alzheimer's caregivers, loss of a child, loss of a spouse, and diabetes education. The Champion program connects trained volunteers with Irvine older adults who may be isolated, have limited mobility, limited support, or other needs. The program currently offers 2 types of services. First, volunteers provide friendly visits to socialize and build positive, consistent relationships. Second, volunteers make brief, scheduled compassion calls up to once per week. These calls are intended to offer social connection, emotional support, and wellness check-ins. This program offers support to participants who need help making appointments or completing applications online. Many older adults do not own a desktop or laptop computer, making it difficult to complete important paperwork or schedule appointments. Using a phone can also be challenging, as small screens and complicated websites are often hard to navigate. Through this program, participants receive assistance with navigating websites such as the DMV, City Recreation, Irvine Valley College online classes, and more.
The Personalized Support Program offers assistance to homebound older adults who lack of funds for in-home care, emergency response system, and taxi rides. These resources are available as a temporary solution for Irvine older adults who have no other means to cover these costs or who need support while seeking for a permanent solution. For example, we are currently providing in-home care services to 100-year-old Irvine resident who lives alone. His only remaining family members are nephews who live out of state. While providing this service, we are also navigating other permanent care options for him. Resource coordination is tailored support for older adults who require more hands-on assistance providing through the short-term follow-ups. This personalized service is designed for participant who has been identified as needing additional assistance. Following the completion of intake form, staff will focus on connecting older adults with the resources and referral tailored to their individual needs. This includes providing short-term follow-ups through the phone call or in-person visit and helping them to coordinate and connect participants to community services, resources, and programs. Here are some examples of a resource coordination comprehensiveness. We supported 80-year-old Korean-speaking woman who came to the Kin Center looking for caregiver resources. Due to her limited English, we immediately connect her with a Korean-speaking staff member who could better assist her situation. We learned that she was caring for her husband who has dementia, and they were struggling financially, falling into a gap where they did not qualify for Medi-Cal or other public benefits. She also had her own health concerns, and during an medical emergency, her husband went missing because he couldn't remember her name. Through our services, we were able to connect her with a Meals on Wheels for both of them, VA services to explore benefits for which they may be eligible, and help with the return home registry enrollment and emergency response system with the GPS tracking to ensure her husband's safety. What started as a single inquiry led to a set of support that truly matched their current situation. Another example is a participant B, who was recently in a car accident and is considering to stop driving, but isn't quite ready to give up her license. While visiting the Kin Center, we assessed her transportation needs and helped her explore her best options. We connect her with a volunteer drivers program for medical appointments and arrange transportation through the age wall for appointment outside of Irvine in southern Orange County. We also work with her to figure out how to use Irvine Connect for trips around the town. Additionally, we arranged for her to meet with a HICAP to discuss possible transportation benefit through her current insurance. We also discussed trips which she can use when she's ready to fully stop driving. These are the two examples of how we provide well-rounded, culture-sensitive resource linkage for Irvine's older adults.
Resource Linkage has an amazing team of multilingual, highly qualified staff, interns, and volunteers who speak Farsi, Korean, Mandarin, and Spanish, each averaging 15 years social service experience and many with advanced degrees and licensure in psychology, marriage and family therapy, social work, and public health. We work closely together to provide seamless services and quick, efficient responses to identified needs. This slide shows contact information and office hours.
This concludes our presentation. We are now ready for the questions.
Thank you so much for that wonderful presentation. I had a question. I know this, we had hearing evaluation resource. I didn't hear that mentioned, and I want to bring that up since that's the most powerful way of preventing dementia, is making sure vision and hearing is intact. So I was pushing for hopefully highlighting that to the population more so they're aware of it. So I'm wondering if that is still in place. And I remember it was very limited previously. It was like one Wednesday a month or something like that. So if you can clarify, is that still available? What's the frequency and how people can benefit from that? Again, with the long-term benefits of keeping the memory sharp and keeping life as vibrant as possible.
We used to offer the hearing aid screening process on site. However, due to unavailability of Sonos, who are our partners, right now, people who are interested in benefit from the hearing screening service, we refer them directly to Sonos, who's located in Irvine. And we are actively looking for other partners who can offer the service on site.
Okay, so individual coming to the Resource Linkage Center would get information about where to go?
Yes.
Okay, that would be helpful. I don't know if there's a flyer or some information. The goal is making people aware of the importance and that they should ask for it and look for it. So that would be helpful to consider for down the line. Thank you so much.
Congratulations. This has been a project that has been in the works for more than a year and a half, and well designed, and going forward is going to be really wonderful. Okay, so one-on-one consultations. The medication review, is that the program that's offered in the Connect every once in a while? Or actually, don't look at how often it is, but it's listed in the Connect when it is available in the community, and at least quarterly we have one program.
Yes, the medication reviews offer monthly, and it is always listed in the Connection Guide.
And do you have any idea how many participants we had in the tax preparation program last year?
I don't remember off the top of my head, but we offered over 12 appointments per day for 12 weeks. So I'm looking at possibly over...
A couple hundred.
Yes.
It's obviously most necessary. When we go to the volunteer driver program, which we talked about last month, what is the distance, or have we determined a distance for how far? You know, with City of Hope and Saddleback and Memorial Care, folks who are attached to those medical groups might find it difficult if we're not providing access outside of the city. So I'm just, has that been determined yet? I'm looking at Ryan because he's so involved with it.
Sure, yeah, I can answer that. I know when the group presented at the last meeting, it was indicated that, you know, there's like a 5-mile distance, and so all medical rides will qualify. I think what that 5-mile radius is incorporating is that being able to use data from the TRIPS program, it's been able to be tracked that the average TRIPS ride for participants is 3.7 miles. So most people are traveling to, of course, a grocery store, pharmacy, things that are close to their house, but that won't eliminate any opportunity for individuals to travel to medical appointments that are beyond that 5-mile marker. That's just something that's set as a baseline, considering that most rides fall within under that 5-mile radius.
And a couple of more. Do we not have a Parkinson's program? We do. Okay. Thank you. And the diabetes education, is that the program that is put on by the Office on Aging?
It is not by Office on Aging. We do have a registered nurse who's currently retired, and she's willing to come in as a volunteer to help us out with a support group.
I did it.
We've been hearing about this plethora of programs in the county, and it's really hard, I would think, to navigate for the average person. So I think having the Keene Center resources, linkages, is really important. And so if someone were to come there, would all of those resources be options given to people? You know, it's difficult to know everything that's out there, but just today we learned about the linkage, the Caregiver Resource Center. I think there are those hidden programs that people don't hear much about, and it's really, I think, for the average person, a good idea to be able to say, look, here's this. I know you even have a list of these things to open up the potential for all the aid that's available to people. So when they come to the Keene Center, are you offering all of what's out there?
We do our best to offer all that they are eligible for. So how it works is that once we receive someone calls or come in, ask for their, share their situation and their needs, then we go through the assessment to identify which program that will be beneficial for and which program they can really get help from. So that's where it comes beneficial that we have a navigator who is expert in resources available in the community, who can sit down with a participant, assess their needs, and provides information that's right for them. Caregiver Resource Center is one of the top resource referral that we make through the Kin Center, and we do our best to assess their needs and provides the best option for all the residents comes through the Kin Center.
So is housing, affordable housing, still the #1 request that you get in the office?
It's one of the top resources they require through the Kin Center.
And do we have any idea how many people are on waiting lists at this point?
We do not have information like how many people are on waiting list for each property because they're managed by their own property and they're not willing to share information with us. The Kin Center, when it comes to the affordable housing, we offer information we have on our site, but our service is more tailored to help them plan for the future. So if there's someone who in needs of immediate housing, we connect them with the agency that can help them with the immediate transition housing information. But for us, we help them plan for the future. So we help them apply for the waiting list that they can remain on the waiting list, how to go about checking their name on the waiting list, and also update them with the upcoming affordable housing that is available in the community.
I also applaud your name changes. I think it makes things so much more clear and helpful for people to understand what's out there. So good job. Thank you. We will now hear public comments on matters not on the agenda, limited to 3 minutes per speaker. Recording Secretary, are there any requests to speak on non-agendized items?
There are none, Chair.
In that case, we will hear announcements and/or reports from staff, commissioners, and subcommittees of this commission. And I know there are several here, so can you please be prepared to come to the podium? Staff announcements?
Yes. Thank you, Chair. There will be a shred event on Saturday, October 25th from 9 to 11 a.m. in the Lakeview Senior Center parking lot. Irvine residents can safely and securely dispose up to 5 banker-sized boxes. The event is first come, first served, and will end early if the truck has reached capacity. Customers who wish to watch their paper be shredded will need to park in a designated area away from the trucks and staff. Irvine Older Adult Services would like to honor the brave men and women who have served our country. If you know a veteran age 50 and over who is an Irvine resident, we would like to thank them for their service by placing an American flag in their yard or at their door in honor of Veterans Day. Flags will be delivered on November 5th and 6th by city dignitaries, staff, and volunteers. Please register any veteran by October 31st at yourirvine.org. The city's annual Veterans Day ceremony will be held at Colonial Bill Barber Marine Corps Memorial Park on Tuesday, November 11th from 11 a.m. to 12:30 p.m. This event is free and will pay tribute to our nation's troops and will honor local veterans groups, and military organizations. Join us for our Twilight Holiday Social on December 5th to celebrate the season with friends and enjoy an evening of holiday cheer featuring hors d'oeuvres, dancing, and live entertainment. Registration will begin on November 3rd at yourirvine.org, course number 1281081. And then lastly, included in your packet is a handout offering a detailed summary of the past events and programs, as well as upcoming programs and services and participation data from the previous 3 months for older adult services. Thank you.
I want to applaud all the folks that worked on the Global Village Festival. It was fantastic. It had a great turnout. Do you know, in fact, how many people were there? Do you have any way?
I have not heard a number of what they believe is there yet, but I'm sure it will come out to us in the next few weeks.
Kudos to the multicultural group that sponsors the event and all the hard work that went into that. It was wonderful. Any commissioner announcements? Pretty. Oh, I'm sorry, I didn't see you.
Sorry. Yeah. There you go. You can go about it, the center. Are we sharing about the community groups? Okay. Or just the announcement?
Yes.
Oh. I thought they were going to.
This is general commissioner announcements, but the special interest groups is coming up.
Okay, so yeah, we have Diwali event, our annual event hosted by Ekta Centers, South Asian Senior Association, and it is on, excuse me, October 17th, which happens to be tomorrow. So look forward to seeing you all. No? It'll be very nice. Yeah. Thank you.
Okay. Now we have the opportunity for older adult special interest groups to provide updates. We have Friends of Outreach, Irvine Adult Day Health, Irvine Evergreen Chinese Senior Association, NADA Association of Iranian American Seniors, and the South Asian Senior Association. So in that order, Friends of Outreach, please.
That'll be exciting. So the Friends of Outreach members are currently working on 220 holiday gift bags that will be donated to local seniors and others who are in need. And we're still accepting money donations, greeting cards, calendars, stationery, lotions, chapsticks, anything that would be useful for a homebound senior. So donations can be dropped off at the Lakeview Senior Center. And we have a new kiosk opening from Friends of Outreach, run by volunteers in the group. And it's going to be open on Thursdays from 10 till 2. And the volunteer crafters who are in the Friends of Outreach group are making things to benefit the local organizations and Irvine seniors. So thank you.
Thank you. Irvine Adult Day Health Services, anyone?
Good morning, Commissioners.
Good morning.
My name is Hollis Dalton. I am the Executive Director of Irvine Adult Day Health Services. We are an adult day health service center in the city of Irvine. We have both licenses, the social and medical model. Thank you, Commissioners. I just wanted to personally give you a thank you for recently touring our center. I am just so thankful for your ongoing support. In addition to, I've enjoyed the opportunities to tell you about our program, but also to build the friendships in the process. And just a special thank you to Michelle for beautifying our center with some newly planted pots and plants in our entryway that look so nice. I have two announcements today. Exciting news. On the 14th, our board of directors voted in a new mission statement mirroring the city's forward thinking of modernizing terminology. Our new mission statement, 30 years now, has to a change. Irvine Adult Day Health Services, together with families and the community, promotes a lifestyle of health, independence, and active living for disabled and older adults. My second announcement is November is our food program fundraising month. I will leave a flyer if you have any interest in helping, but it's everything from a food drive to contributing to the food program in which we serve participants enrolled into our program. Last year, our fundraiser raised $13,347, and our program also served seniors, older adults in the communities, and disabled adults. That was 7,125 meals. And sometimes the participants enrolled in our program, that is the biggest meal of their day. So it's a very important program. We are part of the federal food program in which we receive about half of the reimbursement that it takes to serve individuals in the community. So it's a great fundraiser. I don't have any other announcements if there's any questions.
Thank you very much. We've enjoyed, touring your facility and learning more about what you're doing there. Looks like a great program.
Thank you very much to each of you.
Next, we have the Evergreen Chinese Senior Association.
Irvine Evergreen Chinese Senior Association. This year, we participated in 3 big events. The first, we participated on September 26th, the Friday, the Middle Autumn Festival at Great Park, the Palm Court Art. We got a lot of people show up and a lot of fun, a lot of people to participate. The second is October 4th, Saturday, at the Irvine Health Living Expo. There's also a lot of people, a lot of fun, and we have almost give about 300 fun, we have picture on the fun, give the people 300 people come to our booth. And the third is October 11th, Saturday, the Global Village Festival. A lot of people. I heard almost 30,000 people show up, but I don't know exactly number. But a lot of people, a lot of fun, and a lot of booths. So that day we gave almost 500 fun for the people. So all the people line up, a lot of people. Every year we participate. And so the first global festival, a lot of people every year show up. So we very enjoy participate for the event. And also this coming Saturday, we have our people to speech for the Medicare, because this year, we're going to be start October 15 to December 7 to register for the Medicare for the next year. Because a lot of changes next year for the Medicare. So like Advantage, they stopped. So even for me, I have a medical Advantage, but they say next year going to be stopped. So I'm going to change it to the Medicare supplement, like a PPO. So a lot of people are going to be suffered. Okay. So the afternoon, we also have one lecture for Medicare, for how to change the new Medicare information. Also, we have some entertainment program for the people. So every time show up almost 150 people for our monthly meeting at the Lakeville Senior Center. Okay. So lots of fun. Hope every year we participated for the festival and also for the booths and all the events. Okay. And also December 11, Irvine Evergreen Chinese Seniors Association invite all the, the adult commissioner to participate at lunch at the Zaiqiao. So every year, December 11th, Thursday, noon time. So I wish all the commissioner to remember that day, okay, to participate. Thank you.
Thank you. You mentioned also the Health Expo. That was wonderful, too. It seemed bigger, many more people. Was really nice program. Okay. Anybody from the Iranian American Seniors? South Asian Senior Association.
Okay, thank you. So, good morning. My name is Preeti Singh. I am a volunteer with SASA, South Asian Senior Association. So, just a quick recap, we had, we continued with our weekly classes at Lakeview and Tribuco, and then the socials have been really busy. We have been inviting the Council on Aging to our events to talk about, possible upcoming changes at our lunch and learn programs. And we also participated in the health fair that was held here at City Hall and Irvine Global Village. Of course, that was a very successful event for us as well. Diwali Fest at Great Park, which was on the same day. So it has been really, really busy and active for, the month of October for us. We had about 7,300 people attended that Diwali Fest at Great Park Live. So that was a, really light and very successful event. For the upcoming, we have Diwali at Lakeview Senior Center tomorrow. We're working on it. What we have, recently found is that we can work together with international crafters in, making some things that we need for our events. So for this Diwali event, they created really these nice pouches for us. So they got a project, and instead of buying it from outside, we got it, what we needed to make our giveaways, little things for our program tomorrow. And then we have another one for them, which is like making table runners. So for Christmas time, so that would be. So we're excited to, collaborate and, give them a project and make our needs meet too. And then on the 24th, we have someone come from, again, Council on Aging for explaining these changes that are coming up in 2026. And then we'll assist the people who need language assistance, so we will be there to translate it for them. So that's about it. Looking forward to it, and, a little bit overwhelming, but enjoying. Thank you.
All right, thank you. Now, a report on the Orange County Older Adults Advisory Commission, please.
Am I on? So good timing, ladies. The county's Older Adults Advisory Commission had a presentation from the Orange County Social Services Agency. And there are a couple of main programs that the county provides, and they have been highlighted in a report to everyone, but briefly. Medi-Cal, so that's the California version of Medicaid, is the largest program that is administered by the county. They do accept applications year-round. You have to prove California residency, tax filing status, and your household income. For 26, the Medi-Cal is going to reinstate the asset limits to what they were prior, and I did look it up. I do now know what it is for sure. So in 26, assets over $130,000 for an individual and $195,000 for a couple will be the asset limit. You can own your own home and one car to qualify for Medi-Cal. Why is this important? Because the county is going to go through what they call recertification, and they will be recertifying each and every Medi-Cal participant in the county. So it is possible that we have seniors whose assets are over that limit. It was unlimited for 2 years. It is now back to the limits from 2022. So it's possible we'll have folks who will be pushed out of Medi-Cal and will be back to Medicare and looking at how to work on their assets. The CalFresh program is also administered by the county, and the benefit is $298 a month, and that's for one person. It's not a whole lot to keep you going. The county provides in-home support services, and mostly that is providing financial assistance to the caregiver. So if you qualify, it is possible that your caregiver could be paid for through the county programs. Again, another program that is specifically at the county is Adult Protection Services, and here they investigate reports of abuse, neglect, and exploitation. And this is a social investigation and not a criminal investigation. And included in your report is indeed contact information. Also in the copy of your report is the link to the presentation similar to the one we saw here today, but I did see this morning that the Office on Aging sent me a copy, so I'll provide it to Athena and she can send it out to all of you. The latest Answer magazine came out last week. Wow. Do you have your copies? Did they deliver them? Not yet, okay. But any organizations that want copies, you can call the phone number, which is on a different piece of paper, Rachel. Where did I put it? Is 714-479-0170, and they will deliver you copies. So if you want them in the office, if you want some maybe for tomorrow, you might want to get, 479-0170. And other than that, William Wong and I, Ray's brother, are going to serve on the county's housing task force. That'll be in support of the Master Plan on Aging. And so know that you'll have a couple of very loud voices on the county commission as we go forward with plans for the county's Master Plan on Aging.
Good. And next is the Nutrition Subcommittee report.
On Monday, October 13th, in morning, we have a Nutrition Committee meeting. We have a program update for the congregate. We have totally served 3,412 up to the end of the August. For the Meals on Wheels, same thing for the end of the August. Totally served 5,619. That is in the Lakeview Center. In Tribeca, we have a meal service, 3,615. Then for the volunteers, so far Lakeview has some opening, and also we have some new server and the kitchen assistant. They coming to help. For the lunch, on Veterans Day, November 7th, we have one seating. Usually it's 115 people will, register. For Thanksgiving lunch, November 21st, we can have a friend, so it's 2 seatings. It's all the time is between 11 and 11:15 until the 1 115. For other things, the Tropical kitchen construction still in progress. Probably is another month to be finished. For Rancho, construction still in progress. Probably will be up to the maybe next year, January. Sorry. And they hope the pickleball the construction will be finished by March next year. Will bring more people to join this luncheon service. And that's all. Thank you.
Do we have any additions or deletions to the agenda?
There are no additions or deletions, Chair.
The only item of business is to approve minutes from the September 18th regular meeting.
I move we accept the minutes as proposed.
A second?
I'll second.
Any discussion? Recording secretary, please conduct a roll call vote.
Commissioner Chen?
Yes.
Commissioner Jacobs? Commissioner Sadi? Commissioner Sandlin?
Yes.
Commissioner Singh?
Yes.
Commissioner Wong?
Yes.
Vice Chair Owens?
Yes.
Chair Jacknick?
Yes.
Motion carries, all in favor.
This concludes the business portion of the meeting. There being no further business before the committee, is there a motion to adjourn the meeting?
I make that motion.
A second? The meeting is adjourned at 10:39 a.m. Thank you all for coming.
Recording stopped.